to share their stories, and these are stories that have touched our lives, and I'm sure at the end of today you will not just register yourself as donors, but you will take the message and inspire people around you, your friends or your family, to raise awareness and to have more donors for patients who are suffering with blood disorders. So I'd like to call upon Joyce, who's our little donor here. She's a bone marrow donor for her brother Harish. Joyce, one.
எல்லாருக்கும் வணக்கம். என் பேர் ஜாய்ஸ். நான் அம்பத்தூர்லேருந்து வந்திருக்கேன். என் தம்பி பேர் ஹரிஷ். எனக்கு என் தம்பி பேஷண்ட், நான் டோனர். என் தம்பிக்கு நான் எலும்பு மஞ்சை கொடுத்துருக்கேன். அதனால எனக்கும் எந்த ப்ராப்ளமும் இல்லை, என் தம்பிக்கும் எந்த ப்ராப்ளமும் இல்லை. நானும் என் தம்பி இப்போ ஆரோக்கியமாக இருக்கோம். இதே மாதிரி நீங்களும் மற்றவர்களுக்கு உதவி செய்தால் பல உயிரை காப்பாற்றலாம். இந்த ஆப்ரேஷனை செஞ்சு கொடுத்த டாக்டர்ஸ்க்கும் ரவத்ராஜ் மேடமுக்கும் ரொம்ப நன்றி.
So these are family donors who are committed because they are bonded to their brother or sister, and we have a mother here, Beena Rao. Please, Mrs. Beena, please come, who donated bone marrow for her daughter. And it took us years to convince that bone marrow donation is a safe procedure, and after a long time she was convinced, and then when she finally donated for her own.
और जबकि मैं अभी 1 साल पहले उसका बन मारा हुआ और मेरे साथ मैचिंग हुआ और मैंने डोनेट किया और अभी वो बिल्कुल ठीक है। और थैंक्स टू रेवती मैम एंड डॉक्टर हो। और जब वो 7 महीने की तब से अब तक ब्लड ले रही थी, अब 9 मंथ हो गए, कुछ भी नहीं ले रही है, बिल्कुल ठीक है। एंड थैंक्स टू रेवती मैम। सो
as I said, that these are family donors. What about donating blood or blood stem cells or bone marrow for someone whom you've never seen? In our community, it is very difficult to get blood donors. So if you talk about bone marrow donation or blood stem cell donation, people are really scared whether it's going to affect them, and the awareness is it's just beginning in our country. The US registries have 20 million donors. Compared to ours, we have only a few 100,000, and with a population which is so large as ours, I think we can do better. And I'd like to call upon Mr. Anand, who was a donor for the Datri registry, who's helped make a change in a patient's life. Mr. Anand, please.
That I am able to match a child who has been with thalassemia major, and she is about as Datri maintain a complete patient privacy, data privacy. He just shared with me that I'm been a perfect match for a kid who has been a very little kid, and it's like I underwent the procedure. It was completely safe. And moreover, it is like very simple procedure, and doctor said that we have some kind of pain, but the pain was very minimal and it is very negligible. It is like it's not anything. We can able to do our day-to-day activities, and even I was working for the short period of time. So it has been a very good experience, and I feel that I just saved a child life because I have a kid who is a same 5 years old kid. So it's a good feel that I can able to donate stem cells and save a kid for future. Thank you.
It's indeed a very touching story. So every day in the morning, we ask ourselves a question: why we do what we do? And every day we get an answer. And today's answer was what this gentleman shared about the feelings of the daughter, and we all know why we're doing what we're doing. So we started this registry in 2009. There are a few families which are lucky to find a match from within the family, either a brother or a sister or a cousin. But a lot of patients are dying without a match. So when we started Datri, we knew so many patients who could not find a match anywhere in the world. Because in order to find a match, the ethnicity plays a big role. So if an Indian is suffering from any disease like blood cancer, thalassemia, or any of these diseases, the probability of finding a match from another Indian is very high compared to all the other ethnic groups all over the world. So what happens is, a lot of people ask me, what is this genetic match all about? So the one simple example I give them is, if somebody needs a blood transfusion, you look for a blood group match. And if that person is not available to donate blood, you will still go to some other person who will have the same A positive or any other blood group that can donate blood. But what happens here in this procedure is, as Dr. Ramya clearly shared with you, you need to have this HLA match. So HLA stands for human leukocyte antigen, which is nothing but a biological identity of a human being. So if I have to match with somebody else in the world, then that probability is also very, very low. The probability is almost 1 in 10,000 to 1 in 2 million. But the good news is, in the last about 7 years, we have now increased our registry size. We are about 150,000 donors that we have registered across the country. And we have facilitated 197 transplants. So for us, end of the day, the result in the work that we do is to see happy families like our friend who just discussed about how he went through the surge, the pain, and had 2 children who he lost, and then finally Datri was able to help. So we are just a facilitator, but the person who is actually donating, an unrelated donor, he is the actual person giving life to the patient in need. So what we thought we need to do now is, there's a World Marrow Donor Day that is being celebrated on September 17th, which is the 3rd Saturday of every September. So we wanted to create awareness by doing a cycle ride. So tomorrow we have this cycle ride starting from Chennai to Maracana, and then we are coming back. It's a 200-kilometer ride, and there are about 80 people who are registered, and they are all very committed to creating awareness. And so we thought this is the best way to do that. And I would like to thank TI Cycles because they are partnering with us in this event, and we are giving cycles to some of the pediatric donors and some of the other unrelated donors and some of the patient families. So we want to, end of the day, as I said,